In the previous modules, we have seen together that attention deficit hyperactivity disorder, ADHD, is the most common neurodevelopmental disorder in children, and that the symptoms that impact the functioning of the person with ADHD will persist into adulthood in up to 75% of the cases that occurred in childhood or adolescence. The frequency of ADHD in the population, or what we also call the prevalence, is estimated to be around 2.5 to 5%, and it is often associated with other disorders such as depression or anxiety, as well as problems such as emotional dysregulation. These associated problems are often the primary factor in referring to clinical services. If left untreated, ADHD is associated with a substantial societal burden, including a significant risk for school dropout, partial higher education, unemployment, substance abuse, sometimes criminal acts, accident, leading, unfortunately, to a higher mortality rate. Both pharmacological and non-pharmacological, for example, psychological treatments, are available for individuals affected by ADHD. Pharmacological and non-pharmacological intervention should be viewed as complementary rather than mutually exclusive options. Indeed, while stimulants are considered highly effective in decreasing the severity of symptoms of ADHD in adults, the short and medium term, their effectiveness in treating emotional dysregulation is weaker, suggesting the need for additional pharmacological or non-pharmacological options. Non-pharmacological psychotherapeutic treatment, such as psychological intervention, skill building, environmental intervention, and adaptation, will be discussed in the following modules. In the present module, which focuses on biological intervention, we will examine the role of psychopharmacology and non-psychopharmacological biological intervention in the therapeutic management of ADHD. For this, I will be accompanied by recognized experts in the field, Professor David Coghill and Professor Samuel Cortese. They are the authors of numerous researches and many publications on ADHD. We will see with them what are the true and false beliefs concerning medication, the neurobiological basis of brain functioning, and the differences that we observe in ADHD. How medication treatments specifically address some of these differences. Together, we will study the different categories of medication, such as stimulant and non-stimulant, and how these different medication and molecules work. We will review the proof of efficacy of medication, their positive impacts, how to evaluate the positive effect, but also the negative impacts, the so-called undesirable side effects. We will see how to introduce a drug, what to do beforehand, how to measure the response and personalize the drug treatment, what to avoid, and what to do when a drug does not work. Finally, we will discuss new non-pharmacological biological intervention currently being studied in ADHD. We start the first video together with psychopharmacology.